Okay, making this video just to talk about suction-assisted laryngoscopy and airway decontamination. Is made by Dr. Jim Ducanto, who's an anesthesiologist. It's had clinical trials, and it was proven to reduce the incidences of pneumonia in patients because we're able to suction out the airway during intubation and then also clear out the trachea after you performed intubation, and that way whenever we start to ventilate, we're not shoving blood or vomit down into the alveoli and causing infection, which is going to kill our patients, at least make them spend more time in the ICU. Big quick note is that the head of the cot is tilted between 30 and 70 degrees. This will also reduce the incidences of pneumonia. And leave them there. Unless they're in cardiac arrest, then obviously we're going to have to lay them flat so they can perform chest compressions. I'm going to be intubating with the bougie using the Kiwi grip, and this is just a technique. I don't know who developed this, but it's very easy. You just assume that everybody before you even insert a laryngoscope is a difficult intubation, and you're already prepared. It's in the tube, and the straight end is through this hole, so that provides a grip. And once you advance it, then you just pull that out of the hole, and then just slide the tube down the bougie and into the airway. I've already got my capnography set up. The ventilator is already set at the correct settings, and it's ready to be applied to the tube once I confirm tube placement. I'll be using a large bore Yonker suction catheter with tape over the hole so that it's constantly sucking, so I don't have to hold suction as I'm intubating. And then I also have a 14 French suction catheter to clean the tube, to clear the trachea after I perform the intubation. So with that, we got the suction. I'm using a Mac 3. So keep everything prepared. Want you remembering your P's of whether you're RSIing a patient or they've gone into respiratory failure and you need to perform an intubation. So they're in the right position. I'm going to visualize the airway, suction, and suction if you see vomit or blood around the airway, you're going to want to suction that out, and then down the esophagus and make sure that it's not going to be any obstruction to your vision. Then after you've suctioned out and decontaminated, you insert the Yonker down into the esophagus, and that's to continue anything that's going to continue to come up. You just want to keep suctioning. You're going to want to perform your intubation. I visualize it passing the cords. Now I continue to visualize, and I just advance it. I'm going to go ahead and have my capnography ready. And at this point, I can remove that Yonker. I'm going to have somebody, can you hold this tube steady, somebody? Okay, I'm going to use my 14. That was done. Now apply suction out the trachea. Okay, and just like everything else, I'm going to visualize the waveform on the capnography. I'm going to listen to the epigastric, left lung, right lung, confirm tube placement. Once I have that all confirmed, I'm going to secure my tube and connect my ventilator. And once everything's secured, we're on the ventilator, then we're just going to make sure that we maintain the tube, and if there's pink froth or anything coming out the tube, we're also going to discontinue and suction some more. But that's pretty much it.